I now invite MSF South Asia's Executive Director, Dr. Farhat Mantoo, to frame the humanitarian challenges ahead and progress that is already being made in her opening remarks. In her role as Executive Director, Farhat Mantoo is responsible for seeing the overall strategy of MSF South Asia, and she has spearheaded efforts to put MSF South Asia on our movement map while ensuring that we remain true to our social mission. Farhat, welcome.
So how do I start this day? In the last few days, I have been trying to frame my thoughts about what do I say today that is new, not known to people who are learned and have lived experiences. And if there is nothing new, then why stand here today? And I firmly believe we all care for humanity. It is us and about us, a thread of humanity that brings us together. I'll start with something that I read a couple of days ago, and this is about Fred. Fred is from Malawi. Malawi is a country, just to situate you, in the continent of Africa. And he wrote something that really, for me, resonates the theme of today, why we are together. And what he wrote was, here I am, 22 years later. Who is Fred? Fred is a peer educator with us working in Malawi. But in the year 2001, he was among the first few patients who was able to access antiretroviral treatment. And at that time, the counselor had told him that it would prolong his life. And he thought maybe a couple of years. And today he's 63 years old. If we look at the access to treatment of ART, MSF played a role, health authorities played a role, civil society played a role. But what really made the difference is our patients. It's the people who knew what they endured and had the best solutions. So today, Fred, as a peer counselor, educates people on ARV. I think that for me strikes that the power of when communities, patients, policymakers, health authorities, organizations come together. That is when change happens. And that is when ideas that are somewhere in somebody's mind are ideated into something that is more actionable. I'll take you in these 6 to 7 minutes because I know there are lots of people today who will speak and share their perspectives through different parts of the world. And I will start with Afghanistan. And why do I talk about Afghanistan? And why is it important to bring it to attention today? So for many decades, the people of Afghanistan have faced numerous significant barriers to accessing healthcare, which persist till date. And the health systems are already understaffed, overburdened, underfunded, unable to meet the population needs. The obstacles faced by our female patients in accessing healthcare has further intensified due to long-standing cultural practices, which are now even more intensely enforced in many provinces of the country. In addition, recruiting qualified Afghan women medical staff in some of the projects in the country was already a challenge, and now it is only hampered by the restrictions of secondary and higher education. What we are seeing is that the long-term consequence of denying half of the population access to education has far-reaching implications. And why do we talk about it? It is something that is happening in Afghanistan, not touching us. But I was looking at the statistics there. As per UNHCR statistics in the year 2022, we crossed the 100 million mark of displaced people around the world. And if we look at the number of refugees, between 2021 and 2022, we saw an extreme steep rise. And the top 6 countries where these refugees come from, 2 are our neighbors, Afghanistan and Myanmar. That means all the more we need to talk about it. In a region, because this is something that I've been asking myself, what a paradox. We are talking about a South Asian region that has been influenced by various migratory movements, both within the region and globally. And with two countries that have, in this region, massive number of people either displaced or refugees around the world. And in this context, when we talk about it, what does it mean for us? When out of the countries that I'm talking about, Afghanistan is, I think, one of the very few countries that is signatory to 1951 Refugee Convention. Is it a paradox we talk about it today? That we are talking in a region where there are people who are displaced, people on the move, fragmented approach to working instruments that will help people to know their rights and help governments to deal better with these individuals that are leaving their home, sometimes completely not out of choice. So, is it that there is a time to look at what are the alternate ways? Maybe some instruments, new rules, new laws that need to come in place to make sure that in absence of being a signatory of a convention, how do we make sure that every individual is treated with respect and dignity and they have access to healthcare? What is in a name? How do we define a refugee? Who is refugee? Do we see it in the narrowest sense? We all know that what is facing us, we saw COVID. COVID touched each one of us in any possible way we can think about. We had a family member, a friend, a known acquaintance, anyone around who was impacted. That is, some people say that is a leveler. It taught us that everybody, even if you could afford, but there was no access to health for reasons known beyond what I would talk, because the panelists are going to touch about it. And what is important today for us as MSF is that when we look at the future, that what is in front of us, it is not another pandemic that we are looking at. It is every other thing that we are talking about. Last few months, a lot has been written and spoken about artificial intelligence. We call it, it's a non-human threat, but man-made. And if we do not engage to know how to deal with it, the impact of it can be on both sides. So, COVID also gave an opportunity for us to accelerate on some of the things that have been there for many, many years. But it also exposed the inequities, inequalities that we find around us in the systems between the haves and have-nots, between the global south and the global north. I hope that during the course of the day, we will have all these aspects touched. Health equity is a fundamental component of social justice. What does it mean? Inequality is bad for health. And we have somebody who I would call a tribe of its own going to talk about it today. Then we have a group of people who are in the midst of what I spoke about, from refugees to how people are treated, what are the legal frameworks, what are the instruments that would guide it. Then we have talking about access. When we talk about access, it's not from access to health point of view. It's access to services, to sustenance, access to protection. That is also another important thing. And we hope that today we talk about and touch some of the aspects of the pandemic treaty, health securitization, what does it mean? And last but not the least, we will also talk about, when we talk about free movements, we talk about capital, we talk about economy, we talk about technology. And what does it do to us humanitarians? I think that is another area we would touch together, mainly on disinformation and how we need to prep ourselves for a future that holds all of this. So lots of questions, very few answers. I do not intend to give any answer because I do not believe that I have all the answers. We as MSF believe that we rely on collective wisdom. We believe that we can only progress together as a society if we have a collaborative, action-oriented outcome. So without much ado, and because I know that I'm between you and P. Sainath, who is our next speaker, and we are all looking forward to hearing him. With these few lines, I would like to welcome all of you and hope that the day is not just about the panel sitting here, it's about all of us. We talk about it, and we talk about people who may not be in this room. And how do we make sure that these ideas, whatever we speak today, the dilemmas we talk about, they are translated back to the communities. Thank you very much.